You had a radical mastectomy when?
Breast cancer. Without question, it is the disease many women fear the most.
The usual reaction of patients is disbelief that it could be happening to them.
I was just devastated like at first. I mean, I thought, oh my Lord, you know, the biggest thing that I worried about was, Lord, if I died, what's going to happen?
Being a sort of bottom line person, you know, I just want to know, okay, so what's the bottom line here? I'm going to live? I'm going to die? What do we do?
This is the story of some brave women with breast cancer and the doctors who hope to see an end to their kind of suffering in our lifetimes.
Major funding for Waging War on Cancer with Paul Hassan is provided by Genentech Bio-Oncology, fundamentally transforming the way cancer is treated with the goal of moving cancer toward a more manageable disease. And by Curagen Corporation, a biopharmaceutical company focused on advancing cancer therapy. Additional funding provided by IDM Pharma and by Sanofi Aventis.
Welcome to Waging War on Cancer. I'm Paula Zahn. This year, more than 200,000 women in the United States alone from all walks of life will be shaken to the core of their beings by the news they have breast cancer and start down a long, dark road. Some will find peace, redemption, a deeper appreciation of everyday joys and loved ones. Some will have precious little time to make the adjustment to a life forever changed by this devastating disease. But the survival rate for breast cancer is a brightening picture, and new, less toxic, less disfiguring treatments mean a better quality of life for survivors.
I was healthy, I was athletic, I had a good diet, I did everything I was supposed to do, and here I was diagnosed with this very aggressive form of cancer.
52-year-old adventure racer Louise Cooper found a lump in her breast 7 years ago while training for an event in South America.
How are you?
Louise called a close friend, Dr. Dennis Sleeman, an experienced breast cancer doctor. Dr. Sleeman told Louise he thought the lump should be removed right away, so she had it removed and waited for the results.
I was so surprised when it came back positive that it was malignant, and when they told me that I was HER2 positive, which I had no idea what that meant.
HER2 positive is an acronym for human epidermal growth factor receptor 2. It's a critical cell-talk pathway, a target, if you will. In about 1 of 3 breast cancers, the cancer cells make an excess of HER2 protein due to a gene mutation. This HER2 mutation is not inherited. It's acquired during the woman's life. It's a particularly invasive form of cancer.
If the breast cancer has this alteration, it behaves much more aggressively. It recurs more rapidly and earlier. It forms metastasis much more readily and more widespread. And it doesn't respond as well to hormonal manipulation.
Researchers found that targeting a HER2 cancer with specific drugs in combination with traditional treatments can be less toxic to patients and more effective.
With a targeted therapy, we're really going after the cells that are the bad cells, with leaving the good cells largely alone.
Dr. Sleeman has conducted extensive research on HER2 cancers, so Louise was confident she had found the right doctor and the right treatments.
The visual that I had was this drug being injected into my body, and it was blanketing the cancer cells and blanketing those receptors, and it was thereby going to prevent any further production of the cancer cells. So just that vision was helpful to me.
Dr. Edward Roman, professor of medicine at the Markey Cancer Center at the University of Kentucky, says a crucial benefit of targeted therapy is an improvement in recurrence rates.
When we use this targeted therapy, this monoclonal antibody, in combination with chemotherapy, compared to chemotherapy alone to try to prevent the spread of HER2-positive breast cancer, the rate of recurrence of breast cancer is cut in half compared to giving the chemotherapy without the antibody. That's the biggest leap forward that we've seen in outcome for any group of women with breast cancer in 25 years. So I would call that dramatic.
Louise stuck with her exercise regimen as best she could while undergoing chemotherapy and radiation. It was a matter of trying to maintain some stability in the situation, where a person can easily start to feel lost and powerless.
I was fortunate in that as strong as the chemo drugs were, and the effects are really cumulative. I mean, I found I was running every day, and it was the only control that I felt I had. I needed to be exercising, I needed to be going to the gym, I knew I wasn't going to be racing, but I needed to hang on to something and have some control. I actually think I might have to lose the start with it.
An elementary school teacher when she's not an adventure racer, Louise also received much-needed encouragement during her treatment from her students.
Of course, my students at school were a gift, which is why it was so important to me to work while I was going through the treatment. Even those days when I dragged myself out of bed, knowing I was going to see my students every day, it was so therapeutic for me. And of course it gave me a sense of normalcy.
Regardless of how a woman takes care of herself, the #1 risk factor in getting breast cancer is age. More than 80% of cases occur in women over the age of 50, but often the reason the woman developed breast cancer is never known.
It's hard in most cases of breast cancer to pin it down to a particular individual environmental or genetic cause. There are some genes that run in families that predispose people to breast cancer. It is possible to test for some of those now. The thing that's important for women to know about breast cancer is that most breast cancer occurs in women who don't have risk factors.
There's no single way to reduce the risk for breast cancer, but a combination of approaches could make a difference. There is some evidence that women can lower their risk through healthy lifestyle choices, such as increased exercise, avoiding excess weight gain, and moderating alcohol use. Women should also make sure to get enough B and D vitamins and monitor the use of birth control pills. And in some cases, if they have a lot of risk factors, take chemoprevention drugs like tamoxifen. With new information coming out almost every day, women need to take the lead in learning about their chances of getting breast cancer and how a positive diagnosis should be handled.
The best thing for a woman to understand who has breast cancer is, of course, it's scary. Of course, it's something that induces fear and concern in a large way. But you have time to gather the right information. It's not an acute emergency. You don't have to make a decision for the kind of therapy you're going to have within a week. You have time to gather the information, get the opinions of at least a couple of physicians that have some expertise in the field, and make a rational decision based on that information.
We cannot expect patients to become physicians or nurses, with 1 week of reading of literature, but we're here to facilitate answering any questions and help guide the patients related to the appropriate paths that we can all follow to improve their outcome.
Barbara Singleton has lived in Brunswick, Georgia all her life. After moving into her new home in June of 2006, she had a general physical, and the doctor told her she had a lump in her breast. A mammogram and biopsy confirmed that the 5-centimeter size mass was cancerous.
It was very aggressive. I had to go through and have surgery. Had to have chemo, and from chemo to radiation.
To give herself the best odds of survival, Barbara decided to take part in a clinical trial. Dr. Edith Perez is a breast cancer oncologist at the Mayo Clinic in Jacksonville, Florida.
The clinical trials will give us the answers we need. We have a responsibility to our patients to do the proper studies to figure out if the drugs work, how they may work best, and also the side effect profile. And clinical trials are the only way to accomplish this task. So every situation that we consider standard of care today was the product of a clinical trial that was performed in the past.
Barbara's treatment meant she lost her hair and suffered extreme fatigue and pain in her legs. But she kept her everyday life going.
My friends and most of my family, they felt really, really amazed at how well I was doing. And especially the people at work, when they come on by to see me, they were stunned at the fact that I was doing really well.
Since her treatment, Barbara has spent time spreading the word in her community, especially to younger women, about getting regular checkups and screenings.
And it seemed like a lot of people come to me now since they know that I went through it. And, being away from work for so long, they come to me and I said, well, I've been out, I've been sick, I had cancer, and it was breast cancer. And a lot of the ladies, they talk to you because they actually don't know what to expect, don't know what to go through.
Barbara had the full spectrum of standard therapy for her cancer developed over recent decades.
Breast cancer treatment and outcome has changed dramatically in the last 35 years. For one thing, the concept of breast cancer as just a localized disease in the breast is no longer held. There's obviously a problem in the breast, but the thing that causes the problem down the road is the possibility of microscopic cancer cells that could have spread before the woman ever walked into a doctor's office or had a mammogram.
Mammography may help identify the breast mass, and an ultrasound can show whether the lump is solid or fluid-filled. If a lump or mass is found, a needle aspiration or biopsy can determine whether the mass is cancerous. Sometimes a surgical biopsy or lump removal is recommended, and an estrogen and progesterone receptor test may help to show whether hormone therapy may stop the cancer from growing. After breast cancer is diagnosed, tests are done to find out if cancer cells have spread to other parts of the body. The process is called staging. The stages, 0 through 4, indicate how far the disease has progressed. Depending on all this information, several types of standard treatments are used: surgery, radiation, chemotherapy, and hormone therapy. If appropriate, targeted therapy is also part of the treatment plan. Although death rates from breast cancer are on the decline, in the course of a lifetime, 1 in 8 women will be diagnosed with the disease, and it is still the second most likely cancer after lung cancer to take their lives. But the surgeries and treatments are much less invasive or disfiguring than they were just 20 years ago. Radical mastectomies, the surgical removal of the breast, lymph nodes under the arm, and the chest wall were the norm a couple of decades ago. Doctors thought they had to remove the entire breast and surrounding tissues to give the patient the best chance of survival. That's no longer the case. Surgeons discovered through carefully done clinical trials that they didn't need to take more tissue to increase the chance for a cure.
There were clinical trials done that tested just removing the tumor and the lymph nodes even separately from each other and comparing that to women who had mastectomies. We now have more than 20-year follow-up on the initial lumpectomy trial, and we found that the incidence of metastatic breast cancer showing up in other places in the body and the survival from breast cancer is identical, whether you do a lumpectomy and protect the rest of the breast with radiation treatments, or whether you do a mastectomy. There is not a biologic advantage of doing one over the other.
Dr. Vincent DeVita, former director of the National Cancer Institute, says the financial support for clinical trials was one of the benefits of the National Cancer Act, called the War on Cancer, signed into law by Richard Nixon in 1971.
We were able to expand the clinical trials program. Dr. Bernard Fisher, who I think women in this country should erect a statue to him, because we expanded his ability to do clinical trials, and he asked all the very difficult, very unpopular questions, became very unpopular in his own specialty, about how much surgery you needed to do and whether you needed to do radiotherapy and so forth. And out of that came the transition of breast cancer from a mutilating therapy without much survival to women surviving in greater and greater numbers with perfectly good cosmetic effect.
Dr. Fisher, a researcher at the University of Pittsburgh, was recently awarded a Doctor of Medical Sciences at Yale University for his groundbreaking role in breast cancer treatment and for his unyielding support of clinical trials. But 20 years ago, many of his colleagues didn't support his new ideas.
Dr. Fisher, I used to listen to people pummel him when he was doing this in the early days. Not easy, because he was changing things. Not easy when you change things, which is why, by the way, people were resistant to the Cancer Act. We were really proposing a very big change in how we did research. But you need change once in a while.
Many think the change in the way breast cancer is treated today offers the most compelling evidence of just how far we've come since the National Cancer Act was signed nearly 40 years ago.
Breast cancer is the best, most visible example, because many women walked around disfigured. And now, a woman with a lumpectomy, rather than being disfigured and then dying at a greater frequency anyhow, they don't die anywhere near the same frequency, and they're not disfigured in any way.
We thought it would be fun to give you a look back at this.
Judy Relicki is a sports journalist who came to Florida to join a television news team. 11 years ago, at age 29, she was feeling lethargic and tired and knew something wasn't right. An examination revealed a 2-centimeter mass in her breast.
The bad news was that the tumor was growing very fast. It was growing at a fast rate. That was why it was already 2 centimeters big by the time when I found it and they took it out. It must have grown a lot. So they told me that I had to do radiation and chemotherapy, and of course I was worried about my hair, and I was more concerned about what I would look like than about what supposedly was the best treatment option. I really checked and checked and checked and took the doctor's wisdom into consideration, but I also said, I still have to be able to bear the pain of dealing with the way you look, the way you're going to feel, and I want to do something where I'm actually going to be able to somewhat enjoy some quality of life. Let me see if that's failed.
Judy's concern as a young woman was that aggressive treatment would keep her from living a normal life.
I decided to do each step of the treatments. I decided to do them separately. Some people just cram everything together. They do surgery, chemo, radiation, reconstruction at one time. I have no idea how, but I was not going down that road.
More than a decade after treatment, Judy is cancer-free, still getting checkups, even though doctors think it's unlikely the cancer will return.
Breast cancer has changed me. There were a few good habits that I was already doing that it made me even more passionate about, and there's a lot of bad habits that I'm trying to nip in the bud. The good habits, I would say, include being healthy, spiritually, and physically, and emotionally, trying to be as balanced. I still to this day look back and think how many blessings I had. Sometimes you don't know how much people love you until something like this happens.
Cora Gabbard was just 30 years old and the mother of 2 young boys when she was diagnosed with breast cancer. She found a suspicious lump, but had no idea it could be cancer.
And then I went to the doctor, and he took a needle biopsy of it and told me that he needed to do like another one. And I just decided just to have one go in there and cut it out. And whenever that they did, they found out that it was cancer. I mean, I was devastated because I didn't want to die, and I thought that's what it was, cancer. You hear about cancer and you think that you're going to die. And I just go over and cry. And I was like that for the first 3 months probably.
Cora had more surgery, followed by 6 months of chemotherapy and targeted drug therapy for a year following that.
In her mind, she was going to die. And I would talk to her and try to turn her thoughts around. And it was hard to do, though. Watching her go through chemo and being sick the first day, I mean, because I'm used to her never sitting still. And to see something get her down on the couch and not move, I knew it was pretty tough. But, she was strong.
Cora says the way she got through all of the pain, hair loss, and fear was finding support in her church and family.
They were just so supportive, and prayers, just being there, being able to talk though to somebody. I look at things different, I love life now. Whenever something happens to you, and I'm honestly saying that the Lord helped me through it.
If breast cancer comes back in a patient, doctors say there are effective treatments that can cure the disease, especially if the recurrence is in or near the breast. But if it reoccurs in other parts of the body, the prognosis is probably long-term treatment, not cure.
But when breast cancer gets in the bloodstream and starts showing up in the liver or the lungs or the bones, which are the most common places that it appears, it's not a curable breast cancer almost all the time. And that's the hard truth about breast cancer. We can still treat it then, but it has to stay under some type of treatment, either continuously or off and on, for as long as the woman survives with it.
Oncology nurse Marilyn Becker was leaning against a wall in her home, saying goodnight to her son when she felt something in her breast.
Not only did I find a huge mass, there was some dimpling of my skin, and as a professional, I knew exactly what I had. I didn't need somebody to tell me.
When doctors confirmed her diagnosis of breast cancer and also found a malignant tumor on her liver, Marilyn braced herself for the worst. Her treatment regimen included surgery, chemotherapy, and a stem cell transplant.
I was started several months after I had recovered from that. I was started on hormonal therapy, and I've been on hormonal therapy since.
Hormone therapy, or more accurately, anti-hormone medications, are given to suppress any further growth of tumors. As a treatment for breast cancer, they slow or stop the growth of cancer cells that are present in the body. They can prevent the original breast cancer from returning and can also help prevent the development of cancer in the other breast. Marilyn's been on hormone therapy for 7 years so far. She remains healthy and active, taking care of her teenage son and spending time with her husband. She looks forward to surviving many more years.
I knew that I had breast cancer with liver metastasis, and I knew my chance for successful treatment and cure, to use that word, were slim to none. But I also knew that I was getting the very, very best medical care that I could.
The good news for women who are challenged with this disease is a lot more known than was known even 10 years ago. Targeted therapies are leading the way in this particular disease. Outcomes are dramatically improving, and we can actually see an inflection of the curve up for the first time in terms of survivorship for breast cancer, in large part to probably a combination of things, including screening, early diagnosis, and more effective treatment.
The message I would like to send to all women, not just women of color, just all women, if you've been diagnosed with breast cancer, go ahead, get the treatment, go through it, be strong.
It changes you. It changes your outlook on life. You get your life straight. Everything else, I don't know, just falls into place, I guess.
My mother and my father, who were always opposed to the kind of events that I was involved in. My parents are now went to your next race. They can't support me enough because to them it symbolizes that I'm healthy and I can do it.
The future for women diagnosed with breast cancer gets brighter every day. There are targeted treatments for the more aggressive cancers, long-term hormone therapy for advanced cancers, and less invasive, less toxic treatments for those with other forms of the disease. Curing breast cancer is already commonplace, and breast cancers that can't be cured can be effectively treated and managed. So in no way is breast cancer an automatic death sentence? Millions of women who have survived the breast cancer experience can look forward to many years of active, productive life. That's it for this edition of Waging War on Cancer. I'm Paula Zahn. Thanks so much for joining us.
For more information on the Waging War on Cancer series, please visit our website, wagingwaroncancer.com. For information about cancer diagnosis and treatment, please speak with your healthcare provider. Major funding for Waging War on Cancer with Paula Zahn is provided by Genentech Bio-Oncology, fundamentally transforming the way cancer is treated with the goal of moving cancer toward a more manageable disease. And by Curagen Corporation, a biopharmaceutical company focused on advancing cancer therapy. Additional funding provided by IDM Pharma and by Sanofi Aventis.